Hello, everybody. Good morning. This is your host, Wala Al-Shraida, Shift Nurse in Inpatient Department at Dubai Physiotherapy and Rehabilitation Center, coming you today with a topic about medication administration and nursing documentation. So, what is medication? Medication is any prescription of medications, sample medications, herbal remedies, vitamins, nutraceuticals, over-the-counter drugs, vaccines, or diagnostics and contrast agents used or administered to persons or patients to diagnose, to treat, or to prevent diseases or other abnormal conditions, radioactive medications, respiratory therapy treatments, parenteral nutrition, or any blood derivatives, and intravenous solutions, plain with electrolytes and or drugs, as well as solutions administered used on the patient during procedure, or as well as other solutions administered for the patients during the procedures. Look-alike and sound-alike drugs, or as seen in the medications in the pharmacy as LASA, drugs that are involved in high percentage of medication errors due to the confusion resulting from the similarity of the generic or brand name, the similarity of packaging, and the labeling or clinical uses. Complete prescriptions, which contains patient's full name and MRN or medical record number, prescribing date, age, and the sex of the patient, name of the medicines, and the generic formulation, strength, along with the dose, route of administration, frequency, indication for any PRN dosages, infusion rate for infusion orders, and duration of therapy against each medicine, prescriber's full name, stamp, and the signature or staff identification number or ID as per documentation process. What are the 7 rights or the 7 R's? It is the right patient, meaning the right patient whom we have to give him the medication, the right drug, the right dosage of the drug, the right route of administration, the right timing, the right to be educated, and the right documentation, such as shown in the diagram below. What is medication reconciliation? It is a formal process for creating the most complete and accurate list possible of a patient's current medications and comparing the list to those that the patient has been taking back at home, which is usually done upon admission. What are the methods of medication administration? We have 4 basic categories. First one is the percutaneous or the dermal method, which is applied or absorbed through the skin or through the dermis. Second one is the pulmonary, which is absorbed via the inhalation or any injection through the respiratory system. Third one is the enteral, which is absorbed through the gastrointestinal or the GI tract. Parenteral, which is administered outside the GI tract, which generally uses the needles or even cannulas, which we call as the IVs. First, percutaneous medication routes, which are generally the medications that are absorbed through the skin or the mucous membranes. We have either the sublingual route, which is medications absorbed through the mucous membranes, which is under the tongue, sub meaning below, lingual meaning tongue. This area is extremely vascular, which means more absorption, moderate to rapid rate of absorption, and avoids the digestive tract, meaning that the absorption is not going through the digestive system or the GI tract. Pulmonary medication route, which is to administer the medications into the pulmonary system via inhalation or injection. It is generally used or includes gases, fine mists, or liquids. Most medication used for the bronchodilation for respiratory emergencies. Inhalation is also used for humidification for many patients. The enteral route, which is usually by oral, mouth, gastric through the stomach, and rectal through the rectum. This medication is always absorbed through the GI tract. Extreme vascularity promotes rapid drug absorption and efficacy. The absorption here is more predictable through the GI tract. These medications are administered rectally, do not pass through the liver or are not subject to the alteration in the liver, meaning they are not metabolized by the liver, which means more absorption. It has more advantages for the unconscious patients. Parenteral route, any drug administered outside of the GI tract, meaning that the metabolism is not through the GI tract. Typically, this route involves the use of needles or cannulas. This medication is injected into the circulation or into the tissue membranes. Some parenteral forms, example like IVP, are the most rapid for the drug delivery. Now we go to the nursing documentation. Why do we document? Which is really important for nurses everywhere. It provides a good clinical communication. It provides a good evidence of care. It is a correct and effective treatment. It provides the correct and effective treatment that was given for the patients. It increases safety and reliability. It is a timely delivery content of accurate services that were given to the patient. It is very critical in any emergency situations, and it is an important and professional and medical legal requirement of any nursing practice. And it is to improve the claim and process and reimbursement process for the insurance department in any medical facility. What is the process? The process is the first element of any nursing documentation, and it is aligned with the nursing process. It reflects the principle of assessment, planning, implementation, and evaluation. It is continuous, and the nursing documentation should reflect this. What is assess? It happens at the beginning of any shift. It is a complete shift assessment, and it is completed and documented in the relevant flow sheets that we have in our Salama system. It is relevant also in any handover that happens between the shifts. It has all the patient introductions. It has the required documentation like the safety checks and clinical observations for the patient, and it is also shown in the electronic medical record review. Here we have a small diagram that reflects the nursing process, which starts with the assess of the patient, the plan of care, and it reviews all the orders in it. After that, we have the implementation that provides the care and treatment that includes any treatment or diagnostic tests. And lastly, the evaluation, which evaluates the outcomes and results and the compliance of our process of the treatment. Second, plan. Plan of care includes ongoing assessments, diagnostic tests, scheduled therapies and medications, procedures, and tasks. Orders will populate in the Salama system. Here we have to emphasize that Salama system is our foremost documentation tool here in our facility, and it can be viewed by the multidisciplinary team. It must be cleaned up before any handover takes place because too many orders can result into confusion and can result into harming the patient or compromising the patient's safety. Clinical information that is not recorded within the flow sheets and any changes noted. The plan of the care of the patient should be documented as a real timely manner and in a real timely progress. The real-time progress notes. It includes any abnormal assessment of the patient, like any controlled pain, any new event that happened to the patient. For example, if he was tachycardiac, if he was hypotensive, if he was febrile, any changes in the clinical status or deterioration of the patient, like any deterioration, improvement, or neurological status, any adverse findings or events, like if the IV site was painful, inflamed, or leaking, if it's required any removal, any rash, incontinence, any fall, pressure injury, or any new events that happen to the patient. The patient outcomes after any intervention, like a dressing change, pain management, mobilization, overall improvements, hygiene, or responses to care and treatment. The electronic medical record. It shows or it consists of any kind of storyboard or the storyboard that we have in our inpatient rooms behind the rooms. It concludes the age, the gender, any infections, allergies, weight, diet, the IP summary, which concludes the medical problem risks or orders to be acknowledged, any notes, for example, the admission notes, the ward rounds, or any other useful details, The result reviews any recent and pending results, for example, like the lab results or the summarization of the results that we've had. Medication administration record, the MAR, which concludes of the overdue medications, discontinued or adjusted due to times for medication. Any fluid balance, which is of course input and output. Any review for the lines, drains, including the location, size, and date, or the orders. We should review all the active, continuous PRN orders or scheduled orders or discontinued orders. The nursing orders create and manage as required for the patient care and should be documented and reviewed continuously. Last but not least is the implement and evaluate. All the entries should be accurate and relevant to the individual patient and the individual process of care. Non-specific information such as ongoing management is not useful in documentation. Duplication should be avoided, like the example, medication given as per medication administration record, because we already know that the medication record has a proper documentation for the medication that was given. We have to use professional language, medical terminology, of course, avoid using any abbreviation. We should write the real time in our notes. In any paper medical record, we should use legible handwriting, which can be readable. We have to use a single line strike through so that the original content is still readable. The author or the provider of the alteration must sign the date. He should sign the date and sign and date the revision of the order. And here I should also emphasize that we are paperless, meaning that we use only Salama system. Here are some examples of real-time progress notes entries by the nurses. For example, like time, nursing notes, if there was any complaint, any new findings, pain scale, medication given, or any other intervention given for the patients. Preventing documentation errors. So why should we prevent any documentation errors? We should always pay attention to the patient identifiers. Foremost and important is the ID band that we have for our patients during the admission. We should always pay attention to the laterality of the condition and any alteration of the patient status. We should avoid all late entries. Now I know sometimes we put late entries, but we should avoid it as much as possible. We should avoid entering information into the wrong charts. Verbal orders must be dated, timed, and authenticated promptly by the ordering provider. And we should always emphasize on not taking any verbal order unless it is an emergency. Always document omitted medications or treatments along with the reason for the omission, and always insert reason for addendum notes in the notes in the Salama system. Thank you very much for listening to me, and have a happy day.